Yes. Very good evening to one and all. We welcome to the Decon Positive Mental Health webinar series. We welcome to the resource person, Mrs. Priyamata Srivastava, founder of Let's Approach and emotional wellness coach. And we welcome participants and our teammates on behalf of Manasa Sukkara Mindcare Hyderabad in association with Eloban Counseling Center Hyderabad, India, Forest Creative Heart Studio, Punjab. Thank you all. Over to intro section, ma'am. Thank you once again.
Yeah, good evening, everyone, and thank you so much, Mangai ma'am, for that wonderful introduction. And our resource person for today, Mrs. Priyamvada Srivastava ma'am, is the founder of Let's Broach, an emotional wellness coach. And today we are into the 58th session of, and the topic is third wave of CBT. And Priyamvada ma'am is an expert emotional wellness coach with over 15 years of experience. She's a renowned figure in the field, recognized for her exceptional work and contributions. With a reach of over 5,000 people, Premvada ma'am's dedication to promoting mental wellness has earned her several prestigious international and national awards, including the esteemed Women Face of the Year 2023 by Fox Story India. As an influential speaker on mental wellness, Premvada has captivated audiences with her insightful talks. In May 2023, her compelling presentation on the subject was published by Josh Talks, further solidifying her position as a thought leader in the industry. In addition, she's a registered cyber lawyer with the BCI, demonstrating her commitment to staying at the forefront of emerging technologies and practices. As a founder of Let's Broach, Priyamvada ma'am has been instrumental in introducing groundbreaking approaches to mental wellness. Her innovative concept of story therapy has provided profound healing to countless individuals through a unique group therapy method. She has also authored a highly acclaimed book which secured the top spot on Amazon's ranking and shares her expertise through engaging podcasts. With a PG degree in counseling psychology, Priyamvada ma'am excels as an emotional intelligence trainer, leveraging her extensive knowledge and experience to help individuals and organizations achieve optimal emotional well-being. Over the course of her career in EQ training, she has empowered numerous corporate clients to develop their emotional intelligence skills, enhance relationships, and make better decisions. And with that short introduction, a very, very warm welcome once again to you, ma'am. And the floor is yours. Over to you, ma'am.
Thank you so much, Anita ma'am, and thank you so much, Sunanda ma'am, for this invite to this wonderful platform. I could feel the vibes of the connection and the bond you all have with each other. So thank you for so much for having me here. A wonderful good evening to each one of you. I am Priyamvada Srivastava, and I think I would just like to add a little of whatever wisdom I have and would love to share with you all about the third wave of CBT. So before I start, I can see all of you are actually experienced and are, superb in this field. This is what I'm sensing. So I would love to understand, before I make you understand about my understanding, I would love to know what is your understanding about this topic. So have you heard about this third wave, or CBT is just a concept that it was always happening, it was always there? What is your opinion about it? Since we are less in number, you can unmute and tell me.
Ma'am, when we talk about the third wave, we can only think about the pandemic, the different phases of the pandemic, and
yeah,
that is what came to my mind.
Thank you so much, Anita ma'am. Anybody else would like to add to this? Okay. In the meanwhile, I'll share my PPT with you all so that is it visible to you all?
Yeah.
So the third wave of cognitive behavior therapy, just a request, since I'm sharing my screen with you all, I would be unable to see you all. So whenever you unmute yourself, kindly add your name before speaking or answering me. Okay. So yeah, just a little bit about me before though the introduction was enough to make you all understand. I don't know why it is it's
So
not
sounds are
work.
coming.
Can you see this moving? No,
Yeah.
na?
Your side is the
Yeah,
third
this,
wave cognitive.
I believe it's stuck somewhere. Just okay. Yeah. So my organization is named Let's Broach. I'm an emotional wellness coach. I do provide training to corporate and universities about emotional well-being. I pick up different topics and how they can manage and upscale their EQs. Apart from this, I'm also a cyber lawyer registered with the Bar Council of India. I'm the legal representative of APDH, which is an organization of handicaps in Mauritius. I was invited to Josh Talks as an expert speaker. By God's grace, I was awarded the Women Face of Year by Fox Story. I published my collection of short stories in August 2022. And again, by God's grace, the book was ranked #1 in the logical section of Amazon. So in case you get a chance, you can get hold of the book and go through it. These are short stories. So I can see all experienced faces here, but still I would like to ask you all, when we say CBT, what comes to your mind?
Thinking, which my name is Mary Elizabeth. I am from Chennai.
Hello, Mary.
Can I?
Yes,
Yeah.
yes, please.
Hello. Our behavior is related to our thinking, through which we produce our actions,
Okay.
cognition and behavior.
Yeah, absolutely. So, as per Mary, cognitive, we all know, means thinking, the thought patterns which we have, and behavior is, the actions which we take based upon our thinking, how we behave, how we enact. So, as per her, it is the relation between our thinking and our behavior. Anybody else?
In Sanskrit, go ahead. Go ahead.
Yes, sir.
I'm Dinakara Rao speaking. In Sanskrit, our sentence is Yad Bhavam Tat Bhavati. Yad Bhavam Bhavati. That means as you think, you become.
Okay. Can you just distance the mic from your mouth, the mic piece from your mouth, because I'm unable to follow.
I am not having any mic. Mine is a
Okay.
computer. Are you in a
Okay.
position to listen now? Here.
No, there is a saying called Yadbhavam Tadbhavati. In Sanskrit,
Uh-huh.
there is called Yadbhavam Tadbhavati. What do you think, actually?
You
So I
become.
think that is actually happens. That's what, sir?
Yes, correct. Absolutely.
Your thoughts and your actions and shows in the behavior part. What
Okay.
you
Thank
thought,
you.
that will come into action, and then your behavior
This
reflects the whole thing.
very, very, very beautifully placed, sir. Thank you so much for connecting it with this, and thank you, ma'am, for clarifying it for me. Anybody else who wants to add? Okay, so please mute yourselves. Uh, so see, when I asked you all about you, I believe you all are from. Can who is on unmute? Sunanda ma'am, can you please mute? Please check. Okay, thank you. So see, what I want to highlight before I'm about to start this session is. When I asked you what is CBT, what do you mean by CBT, or what is CBT for you, I got two answers, and both of you gave me an answer of what you thought and related to your thinking. Your definition came up to me. That was your behavior. One important thing which you missed is that I did not ask you CB, I asked you CBT. And when we talk about CBT, we are already providing or talking about the therapy, right? So cognitive behavioral therapy, that is our thinking and behavior when they are related, is a type of psychotherapeutic treatment that helps people to learn how to identify and change the destructive or disturbing thought patterns that have a negative influence on their behavior and emotions, isn't it? So now, cognitive behavioral therapy, which is popularly known as CBT, and it is all over the social media. Who is on unmute? Sorry, but this is very disturbing. Ma'am, can you please check and mute the person who is on unmute? I'll do it myself. Is my screen still visible?
Yes.
Come on, you have to make it slightly enlarge it and make it big.
I'm just trying to find out who is on mute because there's a lot of background noise. So
And that is with Deccan Positive Mental Health. That is one.
Can somebody help me with muting this person, because I'm unable to mute and this is actually disturbing.
Can you mute everybody?
I do not have the, okay, fine. Thank you so much.
No, go ahead.
Yes.
Ma'am, you can just continue, ma'am. You can continue. Sorry about that.
It's okay, ma'am.
Now it is muted. You can.
Yes. So I hope the full screen is visible to you all now. So yes, when we talk about CBT, so CBT is, you can see it is all over the social media. Every second person is talking about CBT, and it combines a cognitive therapy with behavior therapy by identifying the maladaptive patterns of thinking, emotional responses, and behaviors, and by replacing them with a negative influence on any person's behavior, isn't it? So it focuses on changing the automatic negative thoughts that can contribute to and worsen our emotional responses or behaviors, and replacing them with more desirable patterns, more acceptable patterns, or behavior which suits us as well as others around us. So when we actually talk about CBT, CBT is not just a therapy, not just a treatment. I personally believe, and I am a big advocate of this, that CBT is also a tool which upscales the emotional quotient of any person. So through CBT, faulty thoughts are identified, challenged, and replaced with more objective, realistic thoughts. So basically, when we talk about CBT, that is cognitive behavioral therapy, as psychologists, psychiatrists, what we do is when we apply this therapy, we actually intervene into the thinking pattern of our clients or our patients, and then we filter what they are going through. Why it has become so popular, that we'll discuss in the later half. So now I want all of you to share with me that, do you have any experiences about how effective CBT has been in understanding and helping or in upscaling the mental health of your clients or your patients? Any experience of applying CBT on your patients? Any of you, please feel free to share. I'm waiting. Okay, fine. Then I'll share my experience if you do not want to open up. So I use CBT very frequently. I'm not just into trainings, I'm also into individual counselings. So CBT actually gives me very quick results. It actually helps me in approaching my clients with a broader vision. I'm not saying that other therapies are wrong or they're limited or they're not as good as CBT, but I'm saying is CBT actually helps me in understanding and giving results to my clients much faster than they themselves expected. Because you would have seen that when people reach you, they are actually distressed and in so much pressure, but still, the moment you will say, okay, fine, come, we'll have a session with you, they'll ask, madam or sir, how much time it will take to heal. 1 session, 2 session, give me the numbers. Mostly people who are unaware of their mental illness or emotional, they come up with this question as if it is some instant noodle that will be provided. You are damaging yourself, your mental health for last 20 years, and you're coming to me and expecting that I'll give you a Disprin tablet and tomorrow your mental worries will go. That never happens. But yes, CBT has given me results in as early as 5 sessions. So it is really impactful. And that is why I chose CBT or cognitive behavioral therapy today to discuss with you all. Now, when I told you all that there have been 3 waves of CBT, and Anita ma'am told me that with waves, the only thing that comes to her mind is pandemic. Yes, that was one ugly experience which we all faced as human on this earth. But there is a lot more than this that has been divided into waves, or I'll say, steps. So when CBT, the term CBT identifies a family of interventions that are widely recognized as the set of psychological treatments with the most extensive empirical support. Now, when we talk about CBT, it is not monolithic. However, it has been through several distinct eras, generations, or waves. Okay, so waves here, by waves, I mean generations, or its progression. The first generation of this tradition was behavior therapy. The application of learning principle to well-evaluated methods designed to change over, I'll say, behavior. So it was designed to change the pattern in which somebody was behaving or understanding their behavior. By the late 1970s, this behavior therapy had moved into the era of classic CBT. A new generation of methods and concepts were focused on the role of maladaptive thinking patterns in emotions and behavior of the patients, and the use of methods to detect and change those patterns were applied on patients. When we say the first wave of behavior therapies were characterized by behaviorism, it was Albert Ellis and Aaron Beck who pioneered the second wave of behavioral therapies with CBT, that was cognitive behavioral therapy, which integrated a person's thought and beliefs in understanding and changing behavior and emotional experiences, say, such as depression. So Now that when we are in the third wave of CBT, that is the third generation of CBT, it means nothing but a group of emerging approaches to psychotherapy that represent an evolution and extension of traditional CBT approaches, like traditional treatment approaches of cognitive behavior. Now, third wave therapy is prioritized to the holistic promotion of psychological and behavioral processes associated with health and well-being over the reduction of elimination of psychological emotional symptoms. So you would have noticed that all of a sudden, okay, like say 10 years back, when there was when psychology or psychiatry was very technical and it was considered as a taboo, then suddenly what happened within 10 years, that people have started accepting it and embracing it as if, okay, mental health is also one thing to be concerned of. So it is nothing, it is the approach which is changing the mindset of people. That is because now our psychology is also covering the holistic development, holistic behavior pattern, and I'll say the overall health and well-being of people. So when it is like what is that, when we say it is elimination of psychological and emotional symptoms, although that is typically a side benefit, the concepts such as metacognition, acceptance, mindfulness, personal values, and spirituality are frequently incorporated into what might otherwise be considered traditional behavioral interventions. So now all these things are clubbed together, and they are served in the platter to the people around so that they can connect with it, they can implement it, and it becomes easy for the professionals to help and guide the individuals to have a better mental health. Now the arrival of third wave of CBT was declared. Any idea when? How as I mentioned, you like it wasn't that far that we entered into the third wave. Any wild guess that when it came into picture, this clubbing of holistic development and psychology or mental health and well-being? Okay, so it was declared almost 13 years
This year,
ago.
ma'am?
No, ma'am, it was declared 13 years ago. So since the last 13 years,
Okay.
that is why, if you would have noticed, I said that since last 10 years, this taboo is gradually erasing from people's mindset. That okay, because I'm seeing, and I'm 101% sure you all would be experiencing it too. If you'll see my Josh talk, it is a 13-minute video. So I'm talking about mental health, and the audience that I have, they are 10, 15. I'll call them children. They're 10, 15 children aging from 21 till 25 or maximum 26. All of them were so much aware of what is happening in their life. All of them were so much aware of that they need somebody to support them in their mental wellness. So it is nothing like just a generation. When I was in school, when I was in college, I never knew that a concept like this exists, that even in normal circumstances I can go and ask for a support for my mental well-being. It is just the mindset which is changing, and this is nothing but the inclusion of holistic development in psychology. So third wave methods it emphasized such issues as I mentioned, mindfulness, emotions, acceptance, relationship, values, goals, metacognition. New models and intervention approaches includes acceptance and commitment therapy, dialectical behavior therapy, or mindfulness based cognitive therapy, functional analytical psychotherapy, metacognitive therapy, and many more. Now, there, like, nothing comes for free, everything has a controversy with it, and so does the third wave. So please mute yourself. Yeah. So does the third wave. Just the idea that a third wave of CBT has arrived led to significant controversy. And the metaphor of a wave suggested to some that previous generations of work would be simply washed away. But that was not the intent, and that was not the result. So neither it was the intention of people who came up with the third wave or the third generation of CBT, nor it was the result which they achieved. So the generation hitting a shore assimilate and include previous waves. Okay, but they leave behind a changed shore, isn't it? So it seems to us that we are now in a position to begin to evaluate what will be left behind in a more permanent way from the third generation or third wave of CBT. So the only threat which psychologists and earlier thinkers and researchers faced was like whatever.
Madam, there is a lot of disturbance in voice.
Yes, sir, not in my mic. It is in somebody's on unmute. Am I audible now?
Yes, ma'am.
Okay.
Now it is clear, ma'am.
Yes, ma'am. It was somebody else who was on unmute and their phone was vibrating or was conflicting with the laptop connection. So that is the benefit when you are when you know a little bit of IT and psychology, so you can connect. Okay, so when we say like everything, when anything evolves, the only threat, like supposedly when we are habituated of preparing one recipe and some new member in the family introduces an addition to the same recipe. Okay, so we are little insecure, we are little threatened, we are little worried that it might spoil my recipe, or my family members might not like it. It might not be as effective as it was when I used to cook with the traditional recipe. So there are multiple things that comes to our mind. And similarly, the same pattern, the same thought were in the researchers' mind who had generated the second wave of CBT, where they had aligned thinking and behavior together. So this holistic development and words like mindfulness or metacognition or functional analytical approach, dialectical behavior or commitment therapy, relationships, were actually a threat to them because they were scared about the result. They were scared about the implementations. They were scared about the developments or harms that can happen. So it was more an anxiety which developed this controversy than anything solid which they had. And it is proved third generation of CBT has been really successful so far. Now, the only thing that comes to our mind is when I'm saying and when I'm advocating the third generation of CBT so confidently and talking about it, no, it is very good, very good. So the thing that comes to anybody's mind is the third wave actually good? So like many good ideas, CBT has gone through multiple generations of development. One view is that the third wave of CBT is now rolling in, as theory and practice have moved beyond the behavioral therapy. through it, through to incorporate the ideas from cognitive psychology to more modern adaptations. But the third wave of CBT also encompasses many of the innovations and extensions which are now commonly considered under the umbrella of therapy. And it is so broad, it is so widened that the whole concept, the whole ideology, and there's so the implementations, the patterns are changing along with it. In particular, it includes mindfulness based therapy, uh, dialectical behavior therapy, and acceptance and commitment therapy. So the key defining feature is that these therapies are less based on a classical biomedical model and more concerned with addressing problems in functional and contextual terms. So in simple words, if I want to define it, is like this third wave has a more practical approach and better connection or bonding with the patient than the earlier way, the earlier understanding or earlier generations, which had a more theoretical approach and less bonding and connection with the patients. Because if we talk about this, it is like okay, there is something when we are watching an ad, say the instant noodle Maggie. Okay, why the ads are so hit? Till date, most of us who are born in 80s and 90s, we still murmur the same song, 2 minutes Maggie noodles. Okay, why is it so? Because it had hit us at the right place. And so is CBT. It is actually hitting at the right place because the patients are able to connect. Okay, I have this relationship issue. Okay, I have this cognitive behavioral misbelief or mismatch. So there's something, okay, I have issues with acceptance. Okay, I have issues with commitment. So it is actually hitting people at the right place. That is why they're accepting it wholeheartedly. But whatever you want to call these modern contextual incarnations, I'll say incarnations of CBT, there is some evidence to support them. Clinical effectiveness has been demonstrated for particular forms of therapy in a variety of contexts, and so they are sometimes used in practice. But are they cost effective, and do they represent good value for money? That is one question which actually hounds people. A recent study by Feliu Solar and his team actually gave an evidence that CBT is cost effective. Now, actually, if you will connect with what I had told you earlier, that I am able to give result to my patients in just 5 sessions or say 4 sessions, or I actually, when somebody comes to me and asks me, ma'am, how much time will I take to go back to my normal self? I tell them that I cannot guarantee you, but from the very second session, you can start feeling the differences. Okay, and that is what? This is just cost effectiveness. If somebody is coming, day after another, and there's no numbered session, obviously they're paying us and denting their pockets. But if they start getting the result within 2, 3, 4 sessions, it is actually very early, and it is easy for us also to hit and understand the issues which they are going through. So when I say, is it cost effective? So yes, it is definitely cost effective. Now, there are different methods which are applied in CBT. Okay, so there's no doubt that, like I had mentioned multiple times, and you can see in the slide as well, it is mindfulness-based cognitive therapy, acceptance commitment therapy, extended behavioral activation, dialectical behavior therapy, mindfulness-based stress reduction, functional analytic slide. If you want, you can take the screenshot of this slide, so that if you want to do the research or if you want to study these therapies separately, you can just Google these and understand these. Since we have a time constraint, so I'm not getting into the depth. And looking at you all, I'm sure you all must be knowing about these, so I'm taking it for granted. Just confirm me if you have taken the screenshot. I'll change the slide. Okay.
Yes, ma'am.
Yeah. So before I jump to fact check, I want to just elaborate a little more about the methods. So there is no doubt that several concepts and methods that have been central to third wave interventions, okay, like I mentioned, mindfulness methods or acceptance based procedures, decentering, cognitive diffusion, value, psychological flexibility processes are now they have been accepted as part of CBT tradition and indeed of evidence-based therapy, more generally in large part because evidence suggests that they have been and they are proving to be helpful. So these newer concepts and methods are largely coexist side by side. I'll just go back to the same thing. Okay, so all these you're seeing, all of them support each other. So you can apply like say 3 or 4 or 2 multiple therapies at the same time on the same patient to achieve your desired result. So in some cases, we know that traditional CBT methods work in part of changing processes that become central, but the arrival, I'll say, but when we talk about the arrival of the third wave methods, so the third wave's methods have been added to packages that include traditional behavioral and cognitive methods, resulting in useful approaches. Now, when research has begun to identify moderators or indicating when older and newer methods work best with different populations, suggesting that evidence-based practitioners can serve their clients by knowing methods from all of the CBT generations. So while new concepts and methods are important in our opinion, there is a more profound and set of changes that has been introduced by the third wave. A subtle but important change is that there is now greater recognition of the central importance of philosophical assumptions to methods of intervention and their analysis. Now, science requires pre-analytical assumptions, isn't it, about the nature of data, truth, and the questions of importance, and some of the differences between the waves and generations of CBT work were philosophical and not empirical. Now, recognizing this, the interorganizational task force on cognitive and behavioral psychology doctoral education recently concluded that all CBT, irrespective of the training and practices, all CBT should place more emphasis on philosophy of science training in the hope of increasing the coherence and progressivity of research programs. So the best thing about this generation is we are not just depending upon one simple thing and waiting for it to show the result. We are mixing and it might sound weird, but we are actually experimenting with different colors in the palette, like different therapies, mixing them and coming out with the best that will suit a particular individual. So that is the most beautiful part of this third generation of CBT. Now, a fact check. Okay, so The third wave has been far less focused on protocols of syndromes and more focused on evidence-based processes linked to evidence-based procedures. Okay, an examination of assumptions leads naturally to concern for therapies, in theories and models and processes. The third generation was linked with evidence-based procedures. Increased emphasis on process of change and the biobehavioral impact has meanwhile been strengthened by the research domain. So it was emphasized that the role of changeable transdiagnostic processes, that is functionally important pathways of change that cut across various diagnostic categories, were given or are given more emphasis by the moderators and mediators of change. So, in part because of its great process focus, modern CBT, that is the present generation CBT and evidence-based therapy, is more open to the investigation of a wider range of approaches, from humanistic, existential, or analytical approaches, and especially the spiritual traditions. So this promises over time to reduce the dominance within intervention and models that emphasize the role of changeable transdiagnostic processes. And also this promises over time to reduce the dominance within intervention sites of walled of schools of thought or trademark intervention protocols, and to bring different wings of the field together in an evidence-based research for coherent and powerful sets of change processes. So as a purely syndrome focus and syndrome focus weakness, I'll say, and a process focus strengthens human psychology, psychological prosperity, and the thriving of whole person, not merely psychopathology, and is also becoming more central. So behavioral and mental health is ultimately about health, not solely the absence of disorders. This set of changes is accelerating a transition in evidence-based care toward a process-based field that seeks to integrate the full range of psychosocial and contextual biological processes. So such a field is so broad that it stretches the very term CBT almost to a breaking point, and we would not be surprised if that term, soon wanes its importance. So researchers and practitioners alike seem ready to turn toward process-based therapy, which is PBT. So very soon you all would be jumping from CBT to PBT, in which process, procedure, and the linkage are evidence-based and are used to elevate the problems and promote the prosperity of people. Similar to the trend towards personalized and precision medicine, focusing on changeable process that can make a difference in the behavioral and mental health of individuals, provide a way for evidence-based care and say person-centered care to merge under a single umbrella of process-based care. So orienting the field in that direction may ultimately be the most important changed shore produced by the third wave or the third generation of CBT. So that was all about the third generation or the third wave of CBT. You would have been processing it, you would have been incorporating it in your lives, or practicing it in everyday thing, but you wouldn't be aware that it has already so much advanced, and this has become so much easy to us and so much accessible to us that we are now in that comfort zone of practicing the third generation of CBT. Thank you so much. That is all from me today. I hope I could add to some of your knowledge.
Thank you, Premada. Nice talk. Thank you. Thank you.
Yeah, I think your personal experience, Priyamvada, what are the things what therapies you generally use? Like you have mentioned so many methods, no? Your personal experience, what you
Okay.
I don't just share your experience, right?
Yeah, thank you so much, ma'am, for asking about my experience. So I usually I never use CBT alone. So there are multiple things which I mix and match and apply on my clients and patients. And that is why I said like CBT actually is a complete platter, which I have been mentioning to you all again and again. So, like mindfulness, and I focus on the holistic development of my clients, and that is actually giving me results. So, and since I have been using CBT, I can actually tell you all or share with you all that I have 100% client base who come back to me. Okay, so so far, touch wood, my clients are happy, and I am happy that I'm adding some change or some value which they are seeking in life. So you all can start applying it. There's no harm when you connect their everyday life with the therapies which you're applying on them. It is actually effective.
Thank you.
Most welcome.
Good evening, everyone. It was a very nice new perspective of CBT. You have given a lot of methods. Can we have another session where you can explain, the most commonly used methods and with some practical examples so that it would be useful? You said we can go and Google it down, but I don't know how much authenticated, process we will get it when we Google.
I would love to do that any time when the calendar is free. I can, I can return to this platform and I can sense the bond. So I would be glad to be here again.
Okay. Another small question. Yeah. One question, like suppose people come with, okay, for couple therapy, like in the court when they come for divorce and all, which method would be more preferable?
Okay, so ma'am, you won't believe, you would have noticed in my biodata or in my profile that I am double masters, one in cyber law and one in psychology. So after I finished my graduation in law, which was a 5 years course, the first case which came to me was a divorce case. Okay, and because people think, okay, she's a lawyer, even if I have no experience, so it was a divorce case, and I ended up counseling them. And it was that moment when I realized that I am a better counselor than a lawyer, because I could not take the fees for getting them divorced. But yes, I could, manage and get them go under the same four walls. So that is how I turned into a psychologist. So, I'll share a very personal thing which I follow whenever a couple come to me for relationship counseling or couple counseling. Irrespective of any therapy that you apply, it is very important for you to have the husband and wife separately with you for their sessions. Okay, so start with individual sessions and do not call them together for the first few sessions. Only when you feel that they are, now that you are aware of all the truths which they will not admit in front of their partners, okay, then only call them. Otherwise, they'll end up fighting, they'll end up wasting your time. You won't be able to add any value to their life. So whatever therapy you apply, please have 3-4 sessions with the husband separately and 3-4 sessions with the wife separately, and then only call them together for the session.
No, actually, in the court, we only are allowed to have 3 sessions. The counselor is supposed to have
Okay,
3 sessions.
you are associated with with a court?
Yeah, I'm working for the Chengalpet District Court as a family counselor.
Okay, that is good to know. So, okay, then I was talking as a psychologist because when they come to me in the initial stages, so I do this. But in relationship counseling also, CBT will give you faster results. See, one thing we do not accept because of our mindset is that any solution is a solution. Okay, whether the couple is going back together or the couple is getting divorced, both of these are solutions. It can be negative in our parameters, okay, but it could be good for them. So the day you will accept this fact, I'll say again, apply mindfulness and acceptance and commitment therapy, and along with CBT, it will give you result within the second session. But in court cases, ma'am, usually I'll say in court cases, they reach the court level only when they are headstrong, that they
Exactly. After 100 of sessions, they come. Exactly.
Yeah. So whatever therapy you apply, they have already decided. So it is better to let them do what they want to do.
No, but by God's grace, we have done some reunions also. But I didn't know. We're not supposed to take individual sessions also. We are supposed to do couple sessions.
Yeah,
So
that is how it is. The government needs to understand, but I'm glad that your therapy is working. Then you please continue doing what you're already doing.
Thank you so much. God bless you. Wonderful session. Bye.
Thank you so much, ma'am. Okay, sorry, I couldn't follow the question, ma'am. How can we use it with? See, with teenagers, Parul, it is very important to understand that they themselves are struggling a lot. Okay, it is not just that they want to get hurt; it is also that they are handling their own hormonal changes. So, when we have a headache, as simple as a light headache, we cannot perform the way we want to in our everyday life, and we feel so annoyed and irritated. Somebody who is having so much happening inside their body, how do we accept them or expect them to be happy and gala every time? That is not possible. So for any child, especially when they reach the age of 10 or 11, I do not call it pre-teen. Everything is teen nowadays. When a child is in standard 6th, they are aware of all the lifestyle and whatever is happening, okay, in the world. So 10 onwards, please, when you interact with the child, if you are a parent, make sure that you are giving them 100% attention, because many times we feel that, okay, we are doing this, and side by side, if he or she is speaking, let them speak, we'll answer them. We prefer doing multitasking, but that is the worst thing that we do, because when we ask them to hear to us or listen to us, we expect them to give us 100% attention. But when they expect us to hear them, we do not give them 100% attention. Okay, so it is very important that you listen to them full-fledgedly 100% and bring them to a point that they start sharing things with you. This will happen again. First thing is you're listening to them with full knowledge and focus. Second thing is stop giving them instructions and asking them questions, because when you meet your friend, okay, we start our conversation like, how was my day? What did I do? Or what happened in the last 15 days when I did not meet you or did not talk to you? But when we talk to our child, we ask them, what happened in the school? Did you finish your tiffin? What your teacher said? Did you finish your homework? When is your tuition? Did you eat? Why are you not eating? Why are you not sleeping? So it is usually that we end up putting so much questions or so much instructions to them that friend in this bond is lost. So instead of questioning and asking or instructing, start interacting. If as a counselor you want to connect with a teenage child, then CBT is again very, very, very good. And I'll say, do not counsel the child alone. Also, like if you're taking 3 sessions of the child, please keep 1 session for the parent as well, because unless the child will get the environment in the house, they will
Okay. Anyhow, wonderful session. I'm very happy I was in a position to attend. Thank you very much. Sunanda, you can go for the vote of VOT.
Before Sunanda ma'am's takeover, I just have a request. I would love to come again and share whatever is asked. So thank you so much for liking it. Yes, Sunanda ma'am, all yours.
I think we are meeting for the second time also. I remember your style. Am I right?
Yes.
Yes.
Yes, ma'am. I think we have met on Yellow Pond Madurai session.
Yes.
So
I have been attending.
I'm honored that you remember me. Thank you so much.
So my memory has tested.
Yeah. Thank you, Sunanda ma'am, for giving me an opportunity. That was a wonderful session from you, Priyamvada ma'am. And thank you so much, and kindly accept our gratitude on behalf of the Deccan Positive Mental Health Group, which has Manasa Shubhakar Hyderabad, Forest Creative Studio of Punjab, and the Yellow Pond Counseling Center, Hyderabad in India. And dear friends, we will meet with yet another beautiful session next Friday at the same time. Until then, it's a goodbye from all of us here. Take care and have a wonderful evening, all of you. Thank you all once again. Thank you all.
Thank you.
Thank you so much.
Thank you very much.
Bye-bye.
Thank you and good night.